McKenzie method. The McKenzie method is a technique primarily used in physical therapy. It was developed in the late 1950s by New Zealand physical therapist Robin McKenzie. In 1981, he launched the concept which he called mechanical diagnosis and therapy (MDT), a system encompassing assessment, diagnosis and treatment for the spine and extremities. MDT categorizes patients' complaints not on an anatomical basis, but subgroups them by the clinical presentation of patients. McKenzie exercises involve spinal extension exercises, as opposed to William flexion exercises, which involve lumbar flexion exercises. Effectiveness. There is only weak evidence for the effectiveness of the method's use for treating lower back pain. A systematic review published in 2019 found that there was evidence that it could successfully reduce chronic lower back pain in the short term and enhance function in the longer term, but that most studies of the treatment had suffered from methodological flaws, such as small sample sizes and a lack of blinding. Compared to other treatments, the McKenzie method is not better at treating acute pain and disability for people with lower back pain. It may be better than some other approaches for chronic lower back pain, but this evidence for this is insufficient to recommend the method. Exercises targeting midline strengthening, as used in the McKenzie method, are no more helpful for lower back pain than conventional flexion and extension exercises. History. In 1956, McKenzie was treating a patient experiencing pain. The patient lay down on McKenzie's treatment table, and after bending backward for 5 minutes, reported an improvement in their symptoms. This led McKenzie to experiment with specific movement patterns to treat chronic lower back pain and bring about the movement of pain towards the spine, which he called centralization. McKenzie later developed a classification system to categorize spinal pain problems and published books on the topic, including Treat Your Own Back 1980. The McKenzie method was commonly used worldwide in the late 2000s in diagnosis and treatment of low back pain and peripheral joint complaints. Centralization. Centralization occurs when pain symptoms off-centered from the midline of the spine migrate towards the center of the midline of the spine. This migration of pain symptoms to the center of the lower back is considered a sign of progress in the McKenzie method. Extension exercises are sometimes referred to as McKenzie exercises for this reason. According to the McKenzie method, movements and exercises that produce centralization are beneficial, whereas movements that move pain away from the spinal midline are detrimental.